And our last speaker is, I want to thank Joe Jones from joining us from the Urban League, and if you could share your thoughts, Joe.
Sure. Thank you, Governor. Thank you for the invitation. And the Urban League, for those of you who don't know, happens to be a civil rights organization. We are one of nearly 100 affiliates throughout the country, and we're one of 3 in the state of Michigan. And we're 70 years old here in Grand Rapids. And the great majority of our constituency happens to be residents who are of color, communities of color within the urban core of Grand Rapids. And when word came about the Senate's inability or their decision not to vote on this, I personally was greatly disappointed. And I know I can speak on behalf of my colleague in Detroit, and Charles Anderson, in saying the same thing. And while I'm at it, I wanted to give credit where credit is due. I want to give a shout out and recognition to the House for showing foresight and showing leadership in passing the bill. And my hope is that that the Senate will get to a place sooner rather than later where they will see the absolute need for this. Unfortunately, when you consider the communities of color, African American, Latino communities, historically we sit on top of the list with regards to health disparities. And it's organizations like the Grand Rapids African American Health Institute, my colleague Shannon Wilson, who's here, and other community-based organizations who, on a daily basis, we see the ill effects of poor health. And the thought of not being able to access Medicaid really becomes a nightmare. And so what I'd like to do is to, again, highly recommend to the Michigan State Senate to get their tails back in Lansing to vote. And for those senators who have any doubt as to the need of it, I want to welcome them to come to 745 Eastern, Southeast, which is where our headquarters is. And I'll gladly show them why they need to vote in favor of Medicaid reform. Thank you.